Assalamu alaikum, the communication day. The first scenario, Mr. Ahmed, 78 years old man with comorbidities of COPD and hypertension, admitted with pneumonia with CURB score of 5. He was admitted to the surgical ward as medical ward was full. Condition deteriorated in the surgical ward and the patient was intubated, sent to the ICU. There was also a few hours delay in giving antibiotics due to dislodged IV cannula and difficulty to re-establishing IV access. Patient subsequently sadly deteriorated and passed away. Your role, you are the ICU medical officer. Task to talk with Mr. Khalid, the son, have been told about his father's death and is unhappy and angry with the management and wants to talk to one of the medical team. Talk to Mr. Khalid, explain the situation, address his concerns. Are you ready, Dr. Mayada?
Yes, we can start.
Yes, here you go.
Okay. Hi, hello. My name is Dr. Maida, one of the medical doctors. Just can I confirm you are Mr. Khalid, next of kin?
Yes, I am, doctor.
Okay. I understand that you want to talk to one of the medical team.
Yes, doctor. I am really not happy with what you have done. And I don't want to hear any sorry. I want answers and I want to talk to the consultant.
Yeah. First, before we start, I want to begin by saying how deeply sorry I am for the loss of your father. I can only imagine how difficult this must be for you and your family.
Yes, doctor, I heard many of sorry. He came with pneumonia. People can survive this. And you are telling now you are sorry.
Okay. I can hear you and I understand why you feel that way. Your father's we have lost your father and we are really very his well-being was very important to us and it's clear you loved him very much. Can you tell me exactly what do you want to understand about what's happened? What things
Yes,
what's your
doctor.
concern?
Yes, doctor, he wasn't even on the right ward. You sent him to surgery. What sense does that make?
Okay, so I understand that you are concerned about why he was in the surgical ward while he's a medical patient. Am I correct?
Yes, doctor. And I want answers.
Yeah. Okay. Sometimes in the hospital we are running a bit low in the beds, and this really something can happen in the hospital because of a lot of admission, and we are using these beds from other wards like surgical wards or any other wards for our patient. However, your father was daily seen by the medical team, and he is taking the medication and the antibiotic he need to have them, and we try to do our best to save his life and give him the correct treatment that he's needing. Are you following me?
Yes, I'm following you, doctor.
Okay. Despite he was being in the surgical ward, but still we are giving the medical care that he needs.
What medical care, doctor? I heard that there was a delay in giving him antibiotics.
I'm so sorry for that. What was happened, and I understand your frustration about what was that. However, things can happen. Your father was because of his dehydration and for an issue that his cannula wasn't. The team found it very difficult to insert the cannula and start his medication. However, we tried this and we call even we call the anesthetist to insert the cannula. At the end, we insert the cannula and he had his antibiotic despite this delay, but this can happen. However, your father, he wasn't quite well to have this delay in the medication. I understand this is very difficult for you to understand, but things can happen.
So you are saying that surgical staff is incompetent.
I'm afraid this is not what I'm saying. Your father is not treated by surgical team. He has been treated by the medical team. But sometimes people is different, and for insertion the cannula, some people we found it very difficult to have the cannula in, and this can happen. However, we tried all our facilities. Even we told, even we escalated for the ICU team to insert the cannula, and at the end this has happened. However, this is caused some delay in antibiotic for your father.
Well, is that delay caused my father's life? Would things would have been different if he got his antibiotics in the correct time?
I highly appreciated your concern, and I understand that things can maybe run different. However, things can go both ways. I am totally, absolutely agreed with you. If the things going in time, and it's maybe we have a slightly different results. However, the whole picture, I didn't think that it will be changed a lot. I'm
Yes, doctor.
afraid.
But now you already shifted him to the ICU. Should he be in the ICU from the first place?
Um, okay. Just I think I'm lost here. He is deteriorating because of his condition. Uh, sorry, just a minute. I'm lost here. You know that your father is died already.
Yes, yes.
Okay. Yeah. Sorry. Yeah. As the deterioration of his general health, as he has, as you know that your father has a underlying lung condition, which called COPD, and over that he has pneumonia and infection, and his general condition wasn't great when he came in the hospital. Delaying in antibiotic for this reason, which I'm trying to tell you, was not in the best of interest. That's why we take him for the intensive care unit to make sure that he has the care he needs. But
Yes, doctor,
unfortunately
I
and
understand this.
sadly,
But I'm asking, why didn't you admit him from the first place to the ICU?
okay, I get your question. Uh, Absolutely, you are right in asking this question. However, it doesn't work like this. As ICU, we are admitting the patient who need says like uh, in um, in a critical position, they need a care in the ICU, need
Yes, doctor,
supporting
and
for his good
my
lungs.
father's condition was critical already.
Not when he first came to the hospital. When he first came to the hospital, we think ward-based level care is appropriate for his condition. And at the time when we found that his condition is began to deteriorate and not further become a ward-based, we shift him to the hospital, to the ICU.
2 minutes left.
Uh,
Have any more
I
concerns?
don't know. I don't know what to say. He didn't deserve this.
Absolutely. All our patients is appreciates for us, and we hope the result was totally different from what we have now. However, things can happen. And I'm so sorry for the loss of your father. And I know, I exactly agree. I know how you are sad and how your family as well.
Okay, doctor. Okay.
Do you have any more concern?
No, I don't have.
Okay. Okay, thank you. Can we also, if you have any, if you need any help, you and your family, in this sad time, we can help you by asking. We have a team here in the hospital that can help you to go through this hard time. If that sound good?
Yeah, thank you. Thank you.
Do you have any more concern?
No, thank you.
Okay. If it's that okay, I will summarize what we've been discussing, that you was very angry and sad about what's happened to your father, and you think that the treatment and management wasn't as you hope in the hospital. However, we try to give him the medical care he needs. Even he was in the surgical ward, he has been treated by medical team, and we try to provide him the treatment as far as he deserved. And then when we found that his condition was deteriorating, we shift him to the ICU, where he had the intensive care over there. However, things not going in the right way, and sadly we lost him at the end.
Okay, thank you, Dr. My time is up already, 30 seconds extended.
As Dr. Basim said, there is no need to summarize
Yeah.
the thing.
Yeah, because I have a time. That's why I'm just trying to summarize.
Yeah.
I've been lost when you said now he's in ICU. And I think the scenario was he's died. That's why I get confused in the middle.
You know,
Yeah.
if you provide some condolences, support again, or being quiet better than repeating or summarizing the scenario. Anyway, let's hear Dr. La comment, then I will comment. Well done, Dr. Mayad.
Well, Dr. Mayada did great with the concern, but the main theme of the scenario here is medical error. The patient mistakenly admitted to a ward when his CURB score is 5. This need ICU admission from the start. So this is a medical error, should be dealt with a medical error issue.
But normal care score 5 to be admitted in the ward.
No.
Care score 5.
Yeah,
5.
5 is the maximum.
Oh, care score. Okay, sorry.
Yeah.
I'm thinking I'm a news score.
I tried to give you a hint.
News score, yeah.
When you
It's
come.
like a bomb, Dr. Ala. You changed the whole task,
Yeah.
the whole scenario. Yeah, I read it, but
It's
really I didn't
I
pay
read like
attention
news
to it.
score
Yeah.
in my mind. In my mind, all my
Oh my God.
news score. Oh, it's care
Yes,
score.
I read this scenario from a recall, but a really old recall, and they many failed this scenario because they didn't deal with it as a medical error.
Mm.
But the concern, I told you all the concern that mentioned in that recall, and you did it well. But the main issue is that his CURB score is 5, and he was admitted to surgical ward.
Mm. The thing is that even if it is the error, how I will deal at the end, it will be sorry, nothing else. Even if
No, admitting, acknowledge, apologize.
As a medical error, yes.
Yes, as an error. It's supposed to be admitted since the admission to the ICU. But it's a very, very tricky and twisted scenario, really.
Yeah.
I get it from a recall.
Yeah, really. Like me, all while I'm reading it, I read it, and I read it like news 5, news score.
Mhm.
I miss it
It's
completely. Yeah,
okay.
it will be different.
Not only you, Dr. Bayade, even me. I read it, but I didn't pay attention to the score because already admitted and he received his medication
Yeah.
and management. But yes, it's scientific wise, he should be in ICU. As we know, one curve of one, he can be discharged home with oral antibiotic.
Mm.
3 to the ward. 5, this is the maximum and the highest severe score should be in ICU. And he
Yeah.
will receive IV antibiotics. Anyway,
Mm.
thank
That's
you,
why
Dr. Ala. Yeah,
I,
it's like a bomb in the
Yeah,
meeting.
yeah. You give me the bomb.
I am really sorry for being rude or angry.
No,
Rude, sorry.
no, no.
No, no,
It's
no.
okay. It's
Yeah.
okay.
It's,
Really, we need to. This is a lesson to concentrate on while.
You should read
Mm.
the scenario well. I think this is the point.
I read
yeah.
it, but I'm not thinking about care in my mind. For a
Yes.
reason, I read it like news in five.
Yeah, you're
It's
right. It's not easy to pick up it because you are focusing about the whole task now. The loss, breaking bad news. You will never focus on the care and the admission to the ward.
Mm.
Even if you want to talk, you will talk also. You will take time to talk about the cannula dislodgement, but to think about indication of ICU, it's really twisted thing. You should be focused 100%. With the
Mm.
stress of exam, I think a lot of doctors or candidates will miss it.
Yes, that is what I read in the
Yeah,
report that many fail this scenario. It appeared in Malaysia before. Yeah.
you know, Dr. Ala, the problem also, the examiners, they judge on one point, they can fail you in the whole concerns. I
Mm.
mean, if, for example, in this scenario, Dr. Maida did perfect. She covered
Yes,
everything.
be perfect in the concern is yes.
Yeah, but the point of apology for the medical error, if she didn't do or the candidate didn't do that, they will fail the whole skills. Like he didn't or she didn't do anything. This is what I also realized from the experience in communication scenario. Either to do what they want, or like you will fail in everything, even you did great in other concern.
Anyway,
Yeah, we should learn and we should be
Mm.
ready for any scenario. Focus in every word. Be ready for the hidden agenda. I don't know if they will write in the task in this scenario medical error or no, because in every scenario in the exam they are writing clearly the task. Here, what they will write: breaking bad news or talking to the anger. I think they will write talking to angry person, and they will not mention a medical error, because if everyone knows about the medical error, all candidate will get the marks. But I guess they will write the task, talk to the angry person, and the doctor or the candidate who raised it as medical error, he will get a success in this scenario. If not, I think they will fail a lot of candidates. As Dr. Ala said in the recalls, they will fail a lot of candidates because of this. Anyway, again, Dr. Mayada, you finish comment, Dr. Ala?
yes, I'm finished. Yes.
Okay, I will comment again, and again and again. Sometimes we have 1 minute, 2 minutes remains. Never ever repeat or recap or summarize 3 scenarios. I wrote it one day in the group, maybe yesterday or a day before yesterday. Angry person in such scenario. So like you are irritating him again. Listen to me. We have a mistake and we are blamed that we did like that to your father. So like you are again reminding him, and this is not at the time. At the end, you want to make a good closure without irritating the candidates. This is the first scenario. The second scenario, the medical error. Medical
Mm.
error, it's unnecessary. Maybe it will be harmful if you repeat or recap or summarize. Yeah, we had a mistake, and your father already had the complication because of our mistake. Oh my God. Like you are killing him again, right? The third scenario, breaking bad news. So the patient already shocked by the news. And at the end, you want to give him the shock again, like you are killing him twice. So I don't prefer to recap or summarize in both scenarios, or sorry, in the three scenarios. Breaking bad news, angry person, medical error. Avoid recapping at all. If you want, provide support, give leaflet brochure, ask for help or provide some help. Okay, ask for concern, but never ever recap or summarize.
Right.
Okay. Any comment? Apart from that, you did great, by the way. All concern, you address it well about the cannula. Yeah, but yes, I heard one word. I don't know from where you got it, and this is also something maybe fatal. You mentioned to him because of dehydration, we couldn't insert a cannula. So from where the dehydration comes?
Things come.
From your mind. Don't pretend something
What
which is,
happened?
yeah, can explain why this happened. No, it's not accepted. So what written in the scenario, follow it. It was difficult, so it was difficult. What the reason? We don't know. There was difficulty to insert a cannula. That's why you said it well. We called for expert one to insert, and the expert did it perfect, and they inserted. But don't put your touch in the
Yeah.
reason. Okay, so it's not related to dehydration, not related, for example, to machine or something
Compressor.
related technical. Yeah,
Mm.
don't think or don't overthink.
Insert information.
Yeah. Yeah, it's like you are trying to solve it by your mind, but it's not the matter. The matter, it's already happened, and now you are here as a duty of candor to be honest that it happened. We don't know exactly what the reason, but we are already solved. We have solved this problem, and we inserted another cannula. Yes, there was delay, and we are sorry about that. But the delay didn't change the outcome. It might be short time. Don't mention also minutes or hours. You don't know. However, it was for delayed, happened for short time, which will not affect the outcome or the indication effect or the even the life of the father. So be honest, and this is the real delaying the medication or maybe seconds or minutes or maybe 1 hour. We will not say it's more than 1 hour because I don't think it will be more than 1 hour. But don't mention time also. Don't say it was for 1 hour. I am 100% sure it wasn't long. No, for short time. They didn't try it, so it was delayed. Yes, but it was delayed for the time won't. I mean, will not affect the outcome or the even or it's not the reason of his death. What happened for him due to his comorbidity, as you said, pneumonia, severe pneumonia, and as Dr. Ala surprised us at the end, it was because of severe pneumonia and support the patient to be in ICU. And I think the whole scenario will be derived differently. So you will talk about medical error and apology, the action, report, meeting. So this whole scenario will be changed. Right, Dr. Ala?
He will kill
Yeah.
me if I told him that it's error. This angry, this angry guy.
Yeah. Yes, he's angry, but this is your task. Even you are blamed, and this is a mistake. You have to do it. This is the exam purpose, not your protect yourself. I mean, no, we are not here to protect ourselves. We are here to pass the exam. Even in the reality, supposed to be this should happen, but I don't know. It depends on the situation. If he's a strong man, yes, don't tell him, of course. But if he's kind one, you can tell, and you can do it in good approach. But we shouldn't hide the truth.
Yeah.
Okay. Okay. Good. Thank you, Dr. Ala, for this scenario. Although it was previous scenario, but the curb here added, and it make the scenario different. The scenario we did before, I think we did it before. We have practiced this case before, but without curb, and everything was going smooth as Dr. Mayada did. But adding the curb of 5, yeah, it could be a major fatal mistake to admit this patient to the ward. Yeah, the point
Okay.
is, yeah, who want to talk? Sorry.
No, I was just asking if Dr. Mayada has a scenario now.
Yes, she
Okay, for a reason, it looks not, okay, I will send it in the group.
yes, please. Okay, I will add one more also concern regarding admitting to the surgical, not to the medical. As Dr. Maeda did exactly, there was overwhelmed bed or bed crisis, and because of this bed crisis and high flow of patients to our hospital, sometimes, it's not usually, but sometimes we are solving this by admitting certain patient in another department. However, the team will be following the patient even in the other departments. This is our policy, and usually it's not happening, but whenever we have a crisis or bed crisis, we are solving this crisis by admitting. That's why we admit your father in the best interest, if it was in the best interest, but in this scenario it's not in the best interest, of course, because it was an error. So if in the word and curb is 3, for example, or 2, it was in the best interest of your father, and the team was following him appropriately, and the nurses, everything was provided according to the target.
Just, I sent the
Yes.
scenario. Just a question. This patient in the, they didn't ask me to inform him about the error in the what they say in the comment of the task. So we know that it CURB score 5 is fatal. This is from our clinical knowledge.
Yes.
So, but in communication scenarios, you don't need to involve your your clinical knowledge in it. You just, I think, read the scenario. That's it.
No, unfortunately, they need some clinical knowledge.
Yes, there is a
Yes.
skill.
There is clinical judgment,
don't
4
know.
marks for the clinical judgment. That's why I'm saying to you,
They,
sometimes, yeah, they will fail you. Either you got,
okay.
ماشي الحال. بالراحة بالراحة لا.
I send I send the scenario in the group. For a reason,
yeah,
it's
it's long
error.
scenario.
Dr.
And
Basim,
yes, Dr. Salma.
good evening. I was going to comment the same comment as Dr. Maida, but not because of the same things that she mentioned. Because of the stem of the scenario itself, because the stem is saying he was admitted to surgical ward as medical ward was full. So in the stem, they didn't say in a state of ICU for any reason.
Yeah.
Yeah,
Again,
so yeah.
it's tricky scenario. I told you, it's not straightforward. They want from you to say it from the start. This is an error as a clinical judgment, which is very really it's tough scenario if they will judge on your clinical decision upon this word only curve of 5. Anyone or everyone will miss it because of the stress. You will never focus on the score, or you will never.
Yes.
Yeah, that's why it's according to the center and the diet and the examiner. But if you maybe if you show
I
more
will tell you
students,
something,
yeah,
Dr.
go
Basim.
ahead. Yes.
Actually, in this scenario, even if I'm not convinced that the medical error is admitting him into the surgical ward in a state of ICU, I would not mention that to the patient. I would mention that I am sorry, really, because we are sorry. The team is sorry because of other things that happened to him. The delay in the admission in the ICU, the delay in the IV cannula, without mentioning that it is an error, and that's what I think I will do. Just we are sorry, and also the word of incident report will be raised. actually incident report should be raised in this scenario, even if it is not an error, because the patient passed
The
away.
cannula.
The patient already passed away, so there is an
No, no.
incident. There is an incident. Incident report is not meaning that a problem happened or medical error only. Incident that we are making every day in our
No, no.
hospital here.
This is mortality. It's not related to the incident. So the
Or
incident.
mortality. Or mortality.
Yes.
I have to mention to her that
Mortality
uh,
record, but it's not incident report.
mm,
And we
no,
are discussing. Uh,
I mean the death which is happened due to some problems, like delay, like they mentioned, 2 lines,
I am
delay
not
in the
sure about
ICU,
this.
because if
Maybe
we consider it,
the event
uh-huh,
of cannula dislodgement,
mhm.
it can be investigated. Because suppose this cannula supposed not to be dislodged.
Yes, you have to give this man something to investigate.
You want
Something
an
to be
investigation?
any investigation. This man will not be convinced by just saying
Yeah. Yeah.
that's the way.
Just rupture. Cannula, why investigation for rupture?
No, no, no. Don't say rupture, Dr. Mayada. Again. You are saying
No,
rupture.
no, I mean like dislodge or anything. This can happen.
It's
in daily
written as
life.
dislodgement. Don't say rupture. It's dislodgement. Means it's out because of movement or something happened, pulled it out. Dislodgement, clear. Don't say rupture. Okay.
No, I mean like this is not incidents around the cannula thing. This is not. This can happen. Failure
Yes,
of procedure can happen. So it's
it
not like incidents report or something. No, not here.
actually supposed to be secured the cannula for
Yeah,
every.
we don't know why.
Yeah.
It's not. It may be secured, but it's not well secured. Something happened, but this at the end we secured the cannula and put it in. We delay. There is a delay, but at the end, this is not incidents. This happened. These things can happen. The
It's a
only
difficult
thing,
scenario.
yeah,
Difficult
yeah.
scenario.
This if it will be hell if every time we report a cannula things.
You know, uh, my summary to this, according to the examiner wish and your luck. If the examiner accepted the whole discussion, they will give you a good mark. You might say a lot of things, explain and talk and do everything, but still, he's not convinced with your performance and he will minus you. Some examiners, even with just a little of explanation or convincing, he will give you a good mark. This is also what I realized in this PACE's life. They are judging according to their wish. This is, I think, this is what anyone also here can prove that. I think so. So let's wish that we have good examiner with good scenario, clear scenario, without tricky points or hidden agenda. Hopefully. Someone wrote here, Dr. Sarah, she wrote, the scenario was done before with as not medical error. I agree, Dr. Sarah. There was, I said this, there was another scenario, the same concept, but without care. Care wasn't mentioned. So you cannot say this is error. Once there is care of 5, suppose the patient would be in ICU. But the other scenario you are talking about, and we did it in another session, it was about patient, the same issue, but was admitted to the ward after deterioration. He shifted to ICU. While shifting to the ICU, the cannula dislodged, and he passed away in the ICU. Nothing or no error at all. But in this scenario, as Dr. Ala said, there is CURB of 5, which was not mentioned in your scenario, Dr. Sarah. So you cannot judge on both scenarios as the same decision. I think also the other scenario mentioned by the mentor wasn't including the curb. There was scenario with no curb, I mean, okay?
I put the scenario in the group. I think today we are with.
Yeah, I will read it now. Dr. Sarah, even dislodgement is not error. No, we didn't talk about error. dislodgement of cannula is an event which is not accepted, but it happened, but no error at all. Even the report here just to know what happened exactly to investigate, but it's not error. Okay, because it's sometimes it happened, as Dr. Mayada said, maybe rupture cannula or dislodging because of movement, transportation, moving the patient here and there. During CPR, even during CPR, maybe you are doing CPR and already the situation is crisis. So you cannot have any guarantee the cannula will be in place while doing the CPR, the movement. Okay, it's not error. We are not talking about error about dislodgement of the cannula, but being sorry, you have to be sorry for that. I'm sorry, this has happened. Yes, this happened already, and usually it's not happening. But if happens, we are sorry about that. But the delay is not affecting his death or not the leading cause of his death. Okay, I will read the scenario for Dr. Ala. I think he read it, but I will read it for all. Mr. Guilford, 60 years old, was admitted to the hospital with pneumonia. He had the same scenario or what? Oh my God, he had a curve of 65 score of 3. Yeah,
I feel the same, but it's not.
okay.
This-
Curve 65 score of 3 and was febrile on arrival. At the time, you were attending another patient. To another patient, the registrar was occupied stabilizing someone else on the ward. A nurse approached you to urgently prescribe antibiotics and IV fluid in line with sepsis protocol. In the urgency of situation, I prescribed coamoxiclav and IV fluid without reviewing Mr. Guilford allergy history. Unfortunately, he has a known allergy to penicillin, or he's known to be
Known,
allergic. Yes, known allergic to a penicillin, and the antibiotics I prescribed contains penicillin. As a result, Mr. Guilford developed a skin rash and went into anaphylactic shock. He required escalation of care and was admitted to the intensive care unit where he was started on entropes. Speak with Mr. Guilford's son, explain what happened, acknowledge the mistake, address any concern, and offer sincere apology accordingly. Okay.
So
It's
this, so this clear mistake.
Yeah, it's written already.
It's clear mistake. Yeah, just how you deal with.
Yeah, I think also the son will be again angry. Dr. Ala commented earlier, if I can ask, we have already lost the patient, and the task is to augment his anger, show some empathy. If we dealt with case medical error, it will more complicated. Am I right? Yes, it will be more complicated. Like you are doubling your effort. A breaking bad news, lost, patient loss, or dead and medical error. Oh my God, it's the triple. So I don't think they'll bring the scenario in such way. It will be either breaking bad news with the just breaking bad news and delivering this news, or it would be error without breaking bad news. So as Dr. Maeda said, maybe the admission without worsening and death of the patient. But triple, I don't think so. Even Dr. Hatem, even you should admit the mistake and apologize. Of course, you have. It will take more effort from you, and it will take more time from you. Okay, Dr. Ala, ready? I give you more time just to prepare yourself.
Yes, I am ready. But what is the son's name, please?
She will tell you. It's not necessary to be written. Yeah, be ready for any situation. You will not know the name. You will meet the patient without knowing his age. This is exam, so be ready to be something hidden, and you have to explore it.
Okay.
And we have to train on that. Okay, the timer is starting now. Here you go.
Okay. Hello, I'm Dr. Ala. I'm one of the doctors in charge today. May I confirm your name and age, please?
Hi, doctor. My name is Saji.
Okay.
My age is 40.
Okay, Mr. Saji, may I confirm that you are next of kin of Mr. Gul?
Golford.
What?
Yeah, he's my father.
Okay. Mr. Saji, we are meeting today to discuss some of your father's health issue. Is that okay with you?
Yeah.
First, before we start, can you please tell me more? How much do you know about your father's condition or what you have been told so far?
Yeah, I know that my father had this nasty cough. He has this cough for 3 days, and he just came to the hospital today to deal with. And I understand that now he is in ICU. What's happened?
Well, I promise to be honest with you today, Mr. Gavi.
Yeah, please.
First, your father has came with a bug infection in his lung,
Mm-hmm.
and we assisted him, and he was given antibiotic and other medication in the best interest of his condition.
Okay.
Unfortunately, this happened without reviewing his allergy history,
Mm-hmm.
and this unfortunately caused him to suffer some complications.
He has known to be having allergy. I think this is in his record. Every time we came, we have he had this record that he has the penicillin allergy. So
Yes,
what do you want to tell me?
I'm really sorry for that, and I apologize. This shouldn't be happen.
Sorry,
And
doctor, I didn't take it. Which antibiotic he received?
yes, he received penicillin.
Received penicillin. I think this is in the record already.
I'm really sorry for what your father
He
have
has.
been suffering.
Do you check his bracelet? He has bracelet. That he's allergic for penicillin. Did you
Yes,
check that?
I apologize for that. This shouldn't be happen in the first place.
Doctor, what are you apologize for? What are you apologize for? This is you are just ignoring every information that has been given by the bracelet, by the everything, and you are telling me that you are giving my father penicillin despite his allergy. So what happened? What happened? I'm out. I'm everywhere. What happened exactly? Can you tell me?
Okay, I really understand how upset you are. If I may explain to you, your father came with bug infection in his lung and he was given penicillin, unfortunately, without reviewing his
Oh my
history.
God. Oh my God. Are you trying to tell me that you are killing my father?
It was completely unintentional.
Oh
We admit the mistake and we are apologizing. Please accept our apology.
my God. Who did that for my father? Who did that? Who given him the penicillin?
Okay, we are working here as a one team, and we are all responsible for what your father have done.
So you are a team. You are telling me you are a team. No one of your team checked that my father have allergy to the penicillin. No one.
Unfortunately, this shouldn't have been happened, and we will write an incident report regarding what happened. And we also will have an urgent meeting, including the consultant in charge, the risk management team, and the head of nursing to discuss what happened and how to prevent such incident in the future for other patient as well. Please accept our apology again for what happened.
So I will accept. I will all of you. I will send you to the jail. Why my father now he in ICU? Because of your fault or because of his disease? I need to reply now.
Well, unfortunately, your father have suffered an allergic reaction to the penicillin in a form of skin rash and a drop in his blood pressure. And this necessitates transferring him to the intensive care unit.
Now my father in the intensive care, not because of his illness. You're trying to say that he's in intensive care because of your fault. He came here to help him and he trusts you as a doctor and at the hospital. And you are trying to tell me that no one check his allergy and you give him a medication in an error. And now he may die because of your error. How this can help me?
Well, as I told you, it was completely unintentional, and we will investigate this seriously. Now your father is under our close observation, and we are
How you wanted me to trust your close observation and did things while you are killing my father? How can I trust that? I want to complain. I will send all of you to the jail. I will close this hospital.
I apologize again, and I'm really sorry for what your father have been suffering.
Gosh. How is he
Uh,
now?
he is now under our close observation, and he is receiving the proper care and management to hopefully recover from this.
Okay, is he recovering? You mean, or he is still in very critical position?
I appreciate your concern. He will he is. Oh, I'm sorry. What was written in the scenario?
Okay, he's in ICU still.
Okay. Well, till now he still not recovered well, but we will keep you updated once we have any progress.
I'm really afraid to keep to let my father stay here in this hospital while even simple things cannot be managed. Can you tell me why this happened?
As I told you, we will have urgent meeting and we will write an incident report to find out why this happened and uh, review all the process to make sure that doesn't happen again in the future.
Okay, can you tell me where can I complain about what's happened?
Uh, if you want to complain, this is your right, and I will
Of
guide you.
course, it's my right. If of course, it's my right. Just I want where I can complain. Can you tell me?
2
I
minutes
will
left.
guide you. Okay, I will guide you to the patient liaison service where you can file your complaint. And be sure we will provide your father with the best care regardless of your complaint.
I hope so. I hope so. I hope you solve this. But if anything happened to my father, I will not leave you alone.
I apologize
Make sure
again.
that.
I apologize again, and I am really sorry for what your father have been suffering.
Okay. Okay, doctor.
Okay, do you have any concern?
No, I'm
Any
concerned
other
about
concern?
this system. I'm really concerned about this system, and I can't absorb this.
I know this is a difficult situation. Uh, we will do our best to help your father in this situation. Also, I will give you the contact number of our department, and I will personally update you once we have any progress.
Okay. Okay.
Okay. Do you have any other concern?
No, no more concern. I will
Okay.
just need to complain. That's it.
Okay. Thank you.
Thank you.
Still 15 seconds, or you want to finish this scenario?
I'm finished.
Okay. Yeah, I wish so. Okay, well done, Dr. Mayada. As a professional actress, really, I felt like you are really sending him to the jail. You repeated it twice. Okay, let's hear the comment. Well done, Dr. Ala. By the way, you did great and
Very
you
well.
absorbed her anger. but very difficult. She was very tough. Okay, let's hear her comment, then I will comment.
Yeah, I think he did well. That's nothing to do apart from apology and everything, and you offer him that. It's a failure of the system. You said that no one to be blamed, but it's failure of the system because anyone in the process of giving this medication must check if you write it wrong. The pharmacist need to check that. If the pharmacist not check, the nurse need to check that. So it is a failure of a system, and yeah, you address that well, and you told that the patient exactly why to complain. I think you handle it well.
Yes, well done. I agree with you, Dr. Mayada. And I prefer to do such situation in the practice rather than face it in the exam. Believe me, they have very professional surrogate. They can shout, they can even they can leave you while talking. They can do anything and everything. Be ready for any behavior of any surrogate. And according to the scenario and of course the instruction from the examiner, but please try to train how to deal with angry, not only angry, the highest level of angry person. Yeah, if you have partner, everyone should do one time as angry person, and the other will deal with him as a candidate. Why? In the exam, believe me, the stress and the shouting, you will be like quiet. You don't know what to say, how to calm her down or him down. You will try all the scenario and the discussion to calm her down, and still she's angry or he's angry till the end, and maybe you will lose your the anger, sorry, and control over your nerves, and you might be really you might be quiet. You don't know what to say, what to do because of the stress. So please do it in training rather than in the exam. And Dr. Maeda, I think she did it in perfect and professional way. Dr. Ala also he absorbed that all the scenario trying to apologize. Yes, you have to do until the end, apology, then apology, then apology till the last moment. Even at the end, Dr. Ala, if you have 10 seconds more, tell her again, I am sorry. I'm so sorry for what happened. All the apology from me personally and on behalf of the whole team. What happened to your father? Yes, again, you can mention it as a mistake or about this error because it's clear error. And she insists on that. He has a bracelet, he has a record. He already mentioned to you. So apology is the best thing to do in this scenario. Any question,
Okay,
Dr. Ala?
I
Yes.
just have one question. When
Yeah.
she asked to do a complaint, uh, shouldn't her father do the complaint himself, or she
No,
can
no,
do
no.
it
Anyone,
in his behalf?
the problem, autonomy for everything, but for the complaint, anyone can raise a complaint.
Okay,
You got it? So anyone of the family, they can raise a complaint. But for the management, for admission, for refusing, for DAMA signing, this is the autonomy for the patient himself only. But the complaint, anyone can raise it. Unfortunately, that's why you can see a lot of complaints in any hospital, and that's why also there is office receiving such number of complaint, whosoever complaining. It's not related to the patient himself
okay.
because this is a service, and the patient should receive the service. So who can complain against the service? Anyone of the family. But it's
I was just asking because I heard from another session, not here, but this was mentioned, and if the patient himself is conscious, then
okay.
he was the only one have the right to complain for something.
So what you will tell here? Tell me. Imagine how to you can answer here by this
No,
way. Like like, you will fight again. You are
in
trying
this
to
situation
convince
and
here.
in her this act, I couldn't say anything.
Yeah, no, I don't think so. It's her right, even because she's a next of kin, she can do it.
Okay.
Okay, this is the first thing. And as you said exactly, be sure that the complaint will not change the service provided to your father. And try to use these words as you did exactly, sentences. During the error, believe me, it's an intentional error. And this is not our habit. We used to do the best care for the patient. Sometimes, yeah, as Dr. Mad said, there's some failure in the system. Maybe during the admission something happened, but it's an error, clear. But it's not our usual to do such error. It's not intentionally at all. You have to stress on this point, just to relax here or calm her down. However, she will be or she will not, but try to make it in this way. And you did great. Even the complaint, yes, this is my right. What do you think? Yeah, okay, you're right. This is your right. Again, don't argue with her. She's already angry and she needs someone to calm her down, not to argue with her. If you argue with the surrogate, the scenario will be much difficult than you expect. At the end, also, they might fail you. So always use a low tone, be sympathetic, empathetic, apologize from the start till the end.
Okay.
Okay?
Thank
Okay.
you, everyone.
Thank you, Dr. Ala. Well done. And perfect two scenarios as the curb and admission and pneumonia. One scenario was as an error, but we didn't pick up the error. And the second scenario was clear error, not only one error, it's triple error regarding the bracelet, the records, and giving the patient the medication which lead to his serious situation and be admitted to ICU because not of the illness, because of the medication we give to him. And again, it was unintentionally, although it's the best interest of the patient, but it was harmful because of his allergy. Any question, Dr. Mayada, Dr. Ala, about these scenarios, both scenarios today, or any other scenario?
I think I'm done. Thank you, Dr. Mayeda.
Thank you. Okay, any question from others? Any comments? Dr. Selma wrote, yes, it was tough. Yes, it was very tough situation. Repeating the record, repeating the explanation, make you more trying to be defensive, but still you cannot defend yourself. It's an error, and you have to calm her down. Yes, it was great, as Dr. Ala
Did he
also
explain
wrote.
here the medical action?
Yes,
Because
he did. He said and admitted to ICU.
they said in the scenario they provide inotropes, they stop the antibiotic and change
Yeah.
change it.
You're right.
He is not
Yes.
clearly mentioned that
Yes, I think Dr. Ala also he forgot about that when she asked him how is his condition now, and
because
he said
she be angry,
yes.
so he trying to calm her.
To
Yes.
come, yes, exactly. Yes, thank you, Dr. Aisha. We have to put more stress on this point, which is medical correction. We already changed that. We stop it immediately. When we discover this allergy, we stop it and we give the medication that can help to cure this reaction. Don't mention any name, but you already did that. Okay, and patient shifted to ICU for more monitoring. You mentioned the monitoring, but you didn't mention about stopping the antibiotics and giving some medication to recover and to cure this allergic reaction.
Yes, I forget about them. Yes.
Yeah, thank you, Dr. Aisha, for reminding us. And by the way, the medical correction as correction is much important than the administrating issue. Yes, we have to do both, but please don't forget the medical action. Okay. Thank you, Dr. Aisha, again. Any other question or comment? Dr. Ala, it is important not to point to anyone, just prove it is failure. Yes, exactly. The same answer. We are working here as a team, and this is all our responsibility. That's why, on behalf of the whole team, we apologize, or I came here to apologize. So it's not a matter of only doctor or nurse or system. We are all of us responsible about this mistake, and we are all here to apologize on behalf of the whole team. Any other question? Any comment? Satisfied all? Okay. Thank you again, Dr. Mayada,
معلش
Dr. Ala.
دكتور
Yes,
باسم
Dr. Mahi.
معلش
Yes, yes.
حضرتك يا باشا قلت انه اي حد ينفع يريز كومبلين. مش احنا قلنا اذا كان العيان
Yes.
كونشس اورينتد وعنده كاباسيتي he is the one يعني he's right to raise a complaint but others one no one even the first kin.
The complaint is different than the consent, you mean?
لا في consent. كان في سيناريو قبل كده واحنا ناقشناه، كانت حتى الدكتوره سلمى اللي كانت بتتكلم فيه انه هو عايز يرفع كومبلين.
the only patient.
He,
But
your father has the capacity and he is the one. ساعة ما كان في esophageal rupture وكده وقال I want to raise complaint، فقلنا خلاص your father now is okay and has a good mental capacity يعني and he is the one who can he's the right.
We need someone from UK because here in Saudi everyone can complain.
Yes, everyone can complain
And
here.
I think in
But
UK like that
مش
because
دعوة.
anyone can
Let's
speak
ask
and
Dr.
they will
Mayada.
investigate.
Dr. Mayada.
He can complain. He can complain. Especially his father now. He's still not full capacity as he's in ICU, but still he can complain.
If his father or the patient himself is fine.
Now if the patient fine, the patient himself can complain. But the family anyway, if any one of them is not convinced by the management, he can tell his father by any means to complain. At the end of the day, you need to convince the family, all the surrounding, to be happy about the service. But like legally, need by the patient himself if he has the capacity. And but if he has no capacity, like now in this situation, the son can complain.
Still he can. Okay. So it's okay, Dr. Mahi. I think so also. But for the medical plan, suppose only by the patient. I mean the consent, the agreement for medication, agreement for surgery, unless he lost the capacity, as we know. But for the complaint, as in our
Even for because it's public service.
Yes, exactly.
Like the public service can be complained by any person.
Yes. Even
You
for
raise the complaint and everything, and but if you are complaining about a specific thing in your body, you need and you have the capacity for the patient himself. I don't know. I think I make it more complicated, but simply because NHS, you are complaining about public organization for everyone. Anyone can complain. This is the simple one.
Yeah, I agree with that also. I don't know, Dr. Mahi, maybe we mentioned it, but it was for the rupture. I think the decision to leave the hospital. I'm not sure it was about complaint. I don't know. I am not really remembering. Anyway, Dr. Aisha can review it in NHS, or anyone has an NHS who can provide us in the WhatsApp group. But remember, this office is open for 24/7. For everyone can raise a complaint, even hotline. Why? Because it's a service. Okay. If something related to the patient, yes, he can also raise the complaint. If something not satisfied the family, again, the family can complain. So it's a service who can they can complain about anything.
Because it's public service, so any
Yeah.
public service, council, police, anything you can complain. Anyone can complain about the
Exactly.
service.
Yeah, I like here also. I saw a sentence yesterday in a pharmacy. It was a warning letter in the pharmacy. It's a big group in the Gulf. Anyway, it's not related to the name of the company. What was written in this warning? The pharmacist has the right sorry, don't attack the pharmacist for any reason. And if you have any complaint, just contact this number. So anything happen, you can provide a complaint or you can raise a complaint regardless, but don't attack or don't fight because there is a penalty. So the alternative always to raise a complaint, whatever the complaint may be, something very stupid, but they will listen to you what you want to say. You got my point, Dr. Mahi. So it's as Dr. Mahi said, it's a public service. Anyone can complain. They will
Okay, sir.
investigate.
Okay.
Yeah, they will investigate, and accordingly, the punishment or the decision, they will be according to the situation.
Thank you, sir. Thank you.
Okay, thank you, Dr. Mahi, also for your question. Any other comment or question? Okay, thank you again, Dr. Mayada and Dr. Ala. See you tomorrow with the short clinical. Anyone interested to do a short clinical? Any specialty like nervous system? I don't prefer something, but just to make this session active. Or if you have another suggestion, just to make communication and long, alternatively, 1 week, every other week, I mean, for the short and for long and communication in the other week, it's okay. Anyone has a topic to discuss about in the short clinical, we can do it tomorrow. And the next week, we can do long clinical consultation with communication. I'm suggesting that only to be, because I can also notice a lot of candidates interested with the long and communication. But for the short, I don't know. Not all of you interested for the short clinical. So we can make it every other week. 1 week will be for long and communication every day, alternatively. And the next week will be for long clinical communication and short clinical. I can also make it as a suggestion voting in the group. If it's okay for all of you, we can do it in this way. If we want to continue as we are doing nowadays, it's also up to you. This meeting for you. Okay, see you inshallah tomorrow with the short clinical day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.